Good morning. Good morning, friends. Hospice nurse Michelle Ledbetter, certified in hospice and palliative care for over 20 years. This morning we're going to talk a little bit about CPR when somebody is on hospice. So when a person is eligible for hospice, meaning that they have a terminal diagnosis, and if the trajectory continues the way it normally does, 2 physicians in the state of Florida determine that a person is eligible for hospice if they have 6 months or less. Before going on to hospice, the admitting team will talk to the family and the patient about a do not resuscitate order. Now, there are some misconceptions about this. Some people think that you actually have to have a do not resuscitate order to be on hospice, but that is not the case. At least not here in the area that I live. And I do think that some of it might be independent upon each agency. But here's what I'd like to share with you as a hospice nurse for over 20 years. CPR is not a kind thing to do to a body that's already fragile. Back in the day when I worked in ICU, I remember the first time I did CPR on one of my patients. And let me tell you, when I was done doing compressions, I felt like I had done a major workout, run a marathon. My abdominal muscles were so sore. So that tells you how much pressure we have to put on someone's chest to get that heart to move. Imagine if you're older, you're frail, you're at end of life, and you have a disease progression that is weakening the body. As soon as somebody starts chest compressions, you will have broken ribs. And here's the really important part that I'd like people to hear. The possibility of you coming back to baseline, say you have a cardiac arrest, they come in, they do CPR, you're at that stage of end of life, the chance of you coming back to your baseline before you had that event is very small. Very, very small. In fact, when people come back, if they come back, they usually are much worse than when they started. They could be left on life support because they will intubate them, which means put a breathing tube down to move air in and out of the lungs. And they give shocks. It's a rough procedure. And so I highly recommend to people that are going on hospice to look at that. Look if you're ready to not have any intervention should your heart stop or your breathing stop. Me personally, I do not want a DNR. I mean, I do want a do not resuscitate at that time because I don't want to go through all that trauma with maybe a small percent that I might open my eyes again. So that's just my personal opinion for me, but it is a very individualized choice. So I highly recommend looking at what you want for your end of life. Statistically, it's not favorable at that stage. Now, if you do come on to hospice and you choose to keep a resuscitation order going, then if your loved one is at home, they stop breathing, or they have a cardiac arrest, the first thing that you will do, and please confirm this with the agency that you're working with, but you will not call hospice directly. You will call 911 so that they can come and perform CPR. If you do not have a do not resuscitate, if you do have a do not resuscitate order and you are on hospice and a person dies, the first place you call is hospice, and they will walk you through that. there's a lot of intricacies around the billing component of it, because this is a Medicare benefit available to all. And once somebody comes onto hospice, Medicare takes over, and that's a whole different post that I will do later. But I did want to pop on this morning and share that with you. I'd love your feedback. If you found the information that I share helpful, please consider subscribing, following, and sharing. I am so grateful that I have the opportunity to share this educational information with a larger audience. So thank you to all my followers, subscribers. Until we meet again, remember to be good to one another. Bye-bye for now.